Go.
Alright, so next I'm going to get a blood sample. And so I would identify the patient, perform hand hygiene, explain what I'm doing. Next I will get the specimen label and I will fill it out according to facility policy. Most facilities have you do the identification number, the name of the patient, your initials, and the time the specimen was collected. Alright, and so next I'm going to put on clean gloves. And I would obviously make them in a comfortable position. Usually for this, I put them over on a tabletop. I would ask if there's a certain area they would like it to be, the IV to be inserted, the needle to be inserted, insert the arm, put gloves on. I will apply a tourniquet.
And once I retract the needle, I need to hold down the site to control the bleeding. And then I would get my J-tube, take off the cap, and then...
So I apply the tourniquet, I'm going to assess for a good vein.
Hold back to...
Oh, okay, I found one. I will release the tourniquet.
And then...
And make sure the vein
slowly put the...
goes down. Alright, and so next I am going to apply the chlorhexamine for the vein. Make sure not to blot.
Yeah, and then I would wipe down the site to clean it off. And now I'm going to put the clear...
Alright, and so I'm going to let that dry for 30 seconds. And while that's drying, I'm going to get the rest of my stuff prepared and ready.
So I would take this off. So go this onto it.
And so I'm going to apply the tourniquet again.
Tape. Watch it.
Okay, now I'm ready.
And then the
I'm going to tell them to feel a slight pinch and 3, 2, 1.
So I put one piece of tape across and the other piece of tape on top, and then...
So then once I do that, I'm going to push this in.
Either side. Well, this is in.
Once I see blood return, I will twist the tourniquet. And I will go until the desired line, and then once it's good to go, I'm going to grab the gauze, place over top of the insertion site, and slowly
type of catheter using the size of it.
needle.
And then I would get my tube in, and I would take off the cap.
Set that down.
And
I'm going to release the safety.
to clean it off, and then I'll insert it.
And then I'm going to apply pressure for 2 to 3 minutes.
Slowly see if there's any.
And then I will put a adhesive bandage over top of it.
And then I would.
And once I do that, I'm going to take my gloves off, assess for a hematoma in the spot, and I will label my test tube according to facility policy, and then perform hand hygiene and take this to the laboratory immediately. That's it.